Hello everyone, my name is Dr. Mallikarjun Kalashetty. I'm a senior consultant and head of the Department of Clinical Hematology, Hemato-Oncology, Bone Marrow Transplantation and Cellular Therapy at Manipal Hospital, Old Airport Road, Bangalore. Today, I want to discuss with you all about a serious blood disease called as aplastic anemia. All of us know that we have three formed elements of the blood: the red blood cells, which help us transporting oxygen from lungs to all organ systems, giving us energy, vitality. We have white blood cells, which help us in fighting off infections, keep us safe. We also have platelets, which help in preventing bleeding. All the three formed elements of the blood are produced in an organ called as bone marrow inside the bones. Aplastic anemia is a serious blood disease affecting this very bone marrow system. What happens in aplastic anemia is this factory which makes all these formed elements of the blood kinds of shuts down, and hence patients have severe deficiency of all these blood elements. That leads to the condition called as pancytopenia. Such patients have extreme weakness, fatigue, they can become breathless on minimal exertion. They may have various bleeding symptoms like gum bleeding, bleeding from the nose, petechiae and ecchymotic patches. They also are at higher risk of developing various infections. Though it's a serious blood disease, we have various evolved treatment options for aplastic anemia. How do we treat a patient of aplastic anemia? Generally depends on the age at diagnosis, the patient's comorbid illnesses, how fit or unfit the patient is, and also whether the patient has what is known as a suitable donor who can give stem cells. The only curative treatment of aplastic anemia in most instances is what is called as allogeneic bone marrow transplantation. So what we do in allogeneic bone marrow transplantation is we do a tissue typing to see whether the donor and the recipient, the patient, are matched. Such patients who have a suitable donor, we collect stem cells from the donor and then infuse them into the recipient in the process of allogeneic bone marrow transplantation. These stem cells from the healthy donor will then repopulate the deceased bone marrow, replace it, and then produce new blood elements. This is called as allogeneic bone marrow transplantation and is curative in most cases of aplastic anemia. We also have medical treatment modality for those patients who do not have a suitable donor, or the patients who are very old, very frail, who cannot undergo the transplantation. That modality of treatment is called as triple therapy, wherein we use three medicines: ATG or anti-thrombocytoglobulin, Cyclosporine and Eltrombopag. And even with medical management, most patients of aplastic anemia will do well. The information and the message that I want to give today is those patients who have low blood elements should get their blood tests done. And if the low blood elements are persisting, which is called as cytopenia or pancytopenia, we'll have to do a test called as bone marrow examination to confirm the diagnosis. If aplastic anemia indeed is diagnosed, we must know that there are very effective treatment modalities available. Thank you.